I recognize the member for Surrey White Rock to move the motion.
Thank you, Mr. Speaker. I move that be it resolved that this House agree that the current measures that have not adequately addressed the opioid epidemic and commit to making mental health and addictions a priority in British Columbia.
Thank you, member. Please proceed.
Thank you. As we stand here today, for the first time since the spring session, I think it's important to recognize that the tragic opioid crisis that continues to plague our province. Since we last sat in this chamber, the death toll of people who have died of an overdose, fathers, aunts, sons, brothers, sisters, mothers, has risen to over 1,200 this year. Tragically, this year is on trend to be the deadliest since the crisis was first declared 5 years ago. It's incredibly disheartening that 5 years into this public health emergency, we are still witnessing so many deaths, but more troubling is that we continue to see a broken system that is not addressing and helping end the cycle of addiction. We need urgency from this government on this file, and we need it now. I've mentioned many times before in this House how incredibly disappointing it is that we have a ministry whose budget is actually smaller than the office of the premiers. Worse still, many British Columbians were shocked to learn that funding for critical life-saving naloxone kits have been cut for frontline responders by this government. The very people who are often first on the scene of an overdose are seeing their supply of these kits disappear and the funding for it ended. The cost of these kits is much less than the cost of the lives that we are losing. It is simply unacceptable. In attempting to justify these shocking cuts for funding police departments, the Premier claimed that there was a supply issue in our province. Now, this was an alarming thing for all of us to hear, but hours later, the BC Centre for Disease Control publicly contradicted these comments by the Premier, and they reassured British Columbians that there was no supply issues for this life-saving tool in BC. So today, we're in a position where it remains unclear when or how the funding will be restored to the police departments for these kits. Last week, I wrote to the Premier asking for clarity on this critical issue. I still have not gotten a response. In fact, that's not the first time that we've had a lack of response from this government on these critical issues. Earlier this year, our caucus asked for the government to activate the All-Party Select Standing Committee on Health, where all parties can work together and take a public approach to tackle mental health and addictions issues that are faced by countless British Columbians. I think all of us in this House can agree on that. What we got back was an offer for a briefing from the Minister of Mental Health and Addictions, not to work together, an offer of a briefing. This issue should not be about what side of the aisle the idea came from. It should be about taking immediate steps to save lives. Too many people continue to lose their lives to this crisis, and we need this Premier to respond directly to this issue today. British Columbia's mental health and addiction services are already stretched and underfunded before the pandemic, and this system is continuing to struggle under the extra demand resulting from COVID-19. People in need of immediate help are now not only facing a toxic drug supply, but are also face month-long wait lists, a lack of withdrawal management bed availability, and unaffordability on private-run services. It is unacceptable that a person living and having mental health issues or addiction issues has to wait to receive life-saving treatment. We need to do better. We all need to do better. It is clear more action is needed to be taken to meaningfully address this issue and urgently commit to a plan for a comprehensive mental health and addiction system. We cannot be reactionary. Too little is often too late, and we need to do better. People facing addiction in our province can't afford this Premier or this Minister to wait before this crisis continues to worsen. Thank you.